In the deep squat, what I'm looking for is that your ankle, knee, and hip are all in a straight line. Your knees do not cave in. Your hips do not shift to one side. And in the side view here, that your heels don't come off the ground, and that your torso and upper body and thoracic spine do not cave forward over your knees. With the hurdle step, I'm looking at your flexion leg, which is shown here as my right leg, to make sure that your knee does not shoot out to the right or cave in across your body to the left. So I'm looking for it to be straight up and down. And then with your extension leg here as my left leg, I'm looking for stability and balance in your body. Obviously, I don't want you to fall over. And I'm looking to make sure that your hips and your body do not shift to one side. With the inline lunge, I want you to step forward the same distance of the length of from your knee to your ankle. Squat down and have your left knee touch the back of your right heel. What I'm looking for here is that if your hips shift or tilt to one side, if your knee caves in across your midline of your body or shoots out past your body, I am also looking for you to maintain your balance and stability. In the shoulder mobility test, I'm looking for your thumbs to be no further apart than the distance between the top of your middle finger down to the crease in the base of your wrist. I'm also looking for the distance on the other side to be exactly the same. Watch for your body to make sure it does not bend forward or shift to the left or to the right in order for your hands to be placed on your back. The active impingement test is just an extension of the shoulder mobility test. Place your left hand on your right shoulder and raise your elbow above your head, pointing straight up in the ceiling. Record if you have any pain. With a straight leg raise, raise your right leg while keeping it straight and locked back towards your head. Ideally, you should get beyond, if not equal to perpendicular to the ground. Watch your left hip and make sure it does not raise off the ground while doing so. In the trunk stability push-up, I want you to place your hands a little forward from a normal push-up position, thumbs extended, which would roughly be your hairline. I want you to raise your body as a whole unit. Make a comment if any part of your body lags behind while raising yourself up. With the low back extension test, I'm more or less just seeing if you experience any pain while performing this movement, and also seeing if your hips come close to touching the ground. With the trunk rotary test, I'm looking for trunk stabilization as you raise the elbow and the knee on the same side of your body and bring it down to touch and extend back out. Now you only have to extend back out about 6 inches off the ground. In this video, I'm going a little bit too far. You will notice that this is going to be a tough exercise and a tough test to perform, so please be honest with your scoring. Also, try to keep your body in the same plane or parallel to the ground. If you are having difficulty completing a single rep, try touching the alternate knee and elbow. Upon successful completion, mark yourself as a 2. With the trunk flexion test, again, I'm just looking to see if you experience any pain and if you can't get your butt down to your heels or your head close to the ground.